guys, Lauren here with Bizrok. In this week's video, I want to talk about doctor introductions, which really I'm talking about the perfect handoff. Now, docs, if you're listening, I hope you're taking notes and you're like, okay, I like this, like let's do this. Otherwise, this is for the hygienist and the dental assistants in the office. Now, for some of you, I know that you guys probably have a series of questions that you like to do, and or the doctor has some things that they like to do, but guys, hear me out on this, okay? I'm focused on creating the best experience for my patient so that the patient always feel comfortable. You know, as I've joked in the past, we all know that most of our patients don't love coming to see us. So it's like, okay, how do we make such a great experience for our patients? How do we make them feel warm and comfortable and know exactly who they're coming to see, especially if it's a new doctor for them? So whether it's a recall patient seeing one of the doctors for the first time, maybe it's a new associate, maybe it's a fill-in doctor, or maybe they only saw the doctor once and they just forgot. So you want to make sure that that handoff is perfect, okay? So when the doctor walks in the room, you always want to introduce the patient to the doctor and then the doctor to the patient. Remember, it's about the patient. It's not about us, guys. It's about our patients. And so you want to make them feel special. So Susie patient, this is Dr. Smith. Dr. Smith, this is Susie patient. Now, hopefully, if you were following some of our handoff and intro conversations in the past, we talk about hygienist or assistant, you should be building rapport with your patients and getting to know them, and maybe you're following FOR, family, occupation, recreation, so that you can learn something personal about your patient. So for the new patients, you want to learn something personal, and as soon as you introduce the patient to the doctor and doctor to the patient, that's when you want to share with the doctor something personal about the patient. So you might say, Susie patient, this is Dr. Smith. Dr. Smith, this is Susie. Susie and her family just moved here from out west, so we're really excited to have them here. You know, she's actually got 2 children who are already scheduled in to see us in the next few weeks, so we're excited to have her. Just some sort of little something so that you can begin a conversation between the doctor and patient doctor. Occupation is also a great one to ask because maybe that sparks interest. Susie patient is a teacher at our local school. Oh, my kids go to that school. Like, what grade do you teach? Guys, it's just conversational, okay? So for that introduction, you want to be able to pull something personal from the patient and share it with the doctor. Now, for recall patients, especially hygienists, you guys tend to build great relationships with your patients and know their whole life story sometimes, because we all know in dentistry, we're #therapists too, right? Because once they're in our chair, they're telling us their whole life story and everything else. So if there's something that's happened, recently with the patient that you can share with the doctor, share too. Like Susie patient and her family just got back from a trip to Mexico. So she was telling me all about it. They got to go snorkeling with dolphins, whatever it is, guys, just something personal. Okay. I think I've kind of beat that dead horse. I think you guys get how important it is just to share something personal with the doctor. The second part is always doing the 3-question handoff. So sharing those 3-question answers with your doctor in front of the patient. So I always get the question of, well, Lauren, I like to go to the doctor's office and then share something personal and the 3-question answers, or maybe some concerns the patient has, like back there. And guys, I get that and I respect that. And if you have something that's very, very specific for your patient, like something tragic, like, hey, Dr. So-and-so, please don't ask about the patient's, husband. He just passed away a few weeks ago, so please don't ask that. Like, that's something to share privately with your doctor. Or the patient has been through 3 other dental practices in the last couple weeks, so we're number 4 for them. Again, guys, use emotional intelligence, right? Those are things that should be shared in the back with the doctor, one-on-one and privately. Otherwise, share in front of the patient. Let them hear their answers again. Maybe it's the patient is there because they just want a long-term fix and they're tired of having temporary fixes on, number 8 and number 9, and they want a permanent solution, or they want a brighter, wider smile because their kid's getting married at the end of the year. Like, if you ask those 3 questions that, guys, I know you should know by now, then that's whenever you transition and you do it right in front of the patient so that they can hear their answers again. So then the doctor can jump in and ask additional questions. questions, okay? So guys, this is a short video, but it's just a friendly reminder of making sure that that handoff, that doctor introduction is done to the best of your ability to serve your patient. Again, to make it an exceptional experience. So if you need help, if you need guidance, or if you have specific questions that you love to ask your patients, whether it's a new patient or a recall or separated questions, email them to us. Send these at info@bizrok.com. That's info@bizrok.com. So send that over to us. Our team would be happy to look at those and talk to you about what that handoff should look like and help maybe tweak some of your questions if needed. Otherwise, guys, we can't wait to see you and serve you soon.